Hello, I'm Hannah Logan. I qualified as a physiotherapist in 2006. I'm no longer working as a physio. I currently am on a 5-year training scheme. I'm a public health registrar, training to be a public health consultant. When I qualified as a physiotherapist, I knew that that wasn't going to be the career for me, but I felt that it would be useful to work as a physio for a bit of time in order to develop some skills. So I went to work in the Homerton Hospital in Hackney, and where you rotate every 4 months. I ended up working for almost 2.5 years as a physiotherapist. When I was working at the trust, they'd done a staff survey to look at how happy people were in the workplace. They offered everyone 3 coaching sessions for free. It was sort of first come, first serve. And as soon as I saw that being advertised, I applied to be part of that programme. One of the things that the coach advised me to do, which at first I thought was a bit odd, but actually turned to be very beneficial, was to look at job adverts in the newspapers, online, and any job that looked vaguely interesting at all to print off and highlight what I found interesting about the job and what really drew me to the advert. So she said, be as extreme as you want. It could be the CEO of Apple, it could be working in a coffee shop. She said, any job advert you see, print it off. And so I did that, and I highlighted the things that were really I found interesting about the job, and what that shouted out to me very clearly was that I wanted to stay within healthcare, and that the things that really interested me was things around education, was things around prevention and improving the population health. And so that's how we really learned that public health was sort of the career path for me. A key thing for me was getting onto the public health training scheme. So this is a medical training scheme, but actually non-medics are able to apply if they have 5 years public health related experience. Once on that scheme, there's a number of placements that you have to attend. So you have to work in a local authority and you have to work for the health protection team for Public Health England. And once you've done those and you've undertaken some exams, you're able to work in other organisations as long as they've been accredited by the General Medical Council. So that's how I ended up working at Transport for London. Transport for London currently employ a public health consultant, and so therefore there was a placement opportunity to go and work with her. At Transport for London, we have a really good chance of impacting on people's health, because the way that people travel will have a huge impact on their health. So through active travel, through doing physical activity as part of their daily activity, through commuting or walking to the shops or walking for leisure, we're able to influence them getting the amount of physical activity they need to stay healthy. When I look back over my career, I sometimes feel frustrated that I didn't know that public health existed before I did, because it's totally the career choice for me. But actually, on reflection, I couldn't have got to where I've got to today without having undertaken the physiotherapy degree and also working as a physiotherapist, because it did give me the skills and the knowledge to be able to progress into this area. The thing I really love about my job is that it's just so varied. One day I could be writing a policy document for the mayor, and the next day I could be doing some teaching. There's always new things coming my way at work, so I never quite know what's going to land on my desk. And the main thing is that I find it incredibly interesting and really love what I do.